The views and opinions expressed during this program are those of the hosts, guests, and callers and are not necessarily those of this station, its management, or other employees, advertisers, or sponsors.
Good morning. It is Friday, February 7th. I'm Michelle Dials, and you're listening to Talk of the Town on 1230 WSAL. Joining us this morning from Logansport Memorial Hospital, Vicki Bird is here. Good morning.
Good morning. How are you?
Good. And normally your day to come is a Wednesday. But Wednesday was a little bit
right. This
snowy.
Is the second time this year we've missed our regular time, so hopefully by March we'll be back on the first Wednesday.
We will certainly hope so. Well, we're glad you could be here today, and you have a guest with you as well.
I do. I have Crystal Zinsmeister, and Crystal is our care coordinator at the hospital, and we're going to talk today about some changes that we're starting to prepare for and implement at the hospital related to physician offices. I think probably in the newspaper and on our website, the public has started to see some terms like accountable care organization and the medical home, and that's what Crystal's going to chat with us about a little bit this morning.
Okay, and I know that I've seen in press releases and things like that some of those terms as well, and I kind of have an idea of what they mean, but I'm not entirely familiar with what those are. So do you want to start with medical home?
Sure, and really that's kind of where everything does start. The medical home model has actually been around since the 60s, but we're just kind of picking up on it now. And really, it's kind of the foundation. It is a guide for us and gives us our policies, our processes to make our offices function in a way that it's really centered around the patient instead of kind of the physician, which we tend to go towards more now. So that's why it's called that patient-centered medical home, and it's really about making sure the patients have access when they need it, getting those same-day appointments, which I know can be kind of hard to do when you call into the office. You know, letting the patients know how can they get a hold of us if they need something and it's after hours and we're closed. Making sure that we're not duplicating services, following up on those tests that we've ordered, all those kinds of things. And so then that moves us on to the accountable care organization, which there's not only just the side that we're going to coordinate that care, we also have a lot of quality measures that we have to meet as well. And there are numerous measures that we could go into, but they're really detailed as far as, different conditions that the patients may have.
So, I guess as an overview, can you just kind of give some basic examples of what those might be?
As far as the quality measures, those are the measures where we're going to look to the patients and say, if we have a diabetic patient, we really want their A1C, which is a measure of their blood sugar over a period of about 3 months, to be below a certain amount. Or maybe we're looking at their cholesterol levels, and we really want their LDL or their bad cholesterol to be below 100. There are measures as far as blood pressures. If they have maybe, other than diabetes, maybe they have congestive heart failure. We want to make sure they're on the correct medications. And these are all evidence-based measures.
Now, you said when talking about the medical home that in the past it has kind of centered on the physician. How has it centered on the physician, first of all?
Well, it's typically you call into the doctor, you come in for your 15-minute appointment every 3 months, 6 months a year, and then, you come back when we say you need to come back and see us. And really, we're going to change that to where we're going to have care coordinators in the offices. And so if, let's say you come in and you're newly diagnosed with high blood pressure, and we know in that 15-minute appointment with the doctor, you really can't get all the education maybe on the disease itself, on the medications that you're going to have to start taking. So we're going to have those nurses in the offices that will then follow up between those appointments with you. Making sure you understand maybe the lab work that needs to be done, making sure you have a way to get there if that's kind of standing in your way of doing that. If you have questions on the medication or the side effects, or maybe we've given you the prescription and you can't get to where you need to get it filled, or maybe it's too expensive. So rather than just waiting and finding those things out the next time you come back to the doctor, we're going to be following up to make sure we're taking care of you between those visits.
So it's not really anything that the patient has to do on their own. It's going to be that they're seeing maybe increased customer service type activities?
That would be a great way to explain it as well. Now, we are going to be working more closely with the patients. We want them to be part of their care plan. Some of the things we're going to ask of the patients, to let us know, do you see a specialist or a doctor that's not in our network that we can, talk to and maybe get those records from to make sure our record for you is complete? If you do have a test maybe outside of us, we want to have those results so that we can really coordinate that care so we don't maybe duplicate a test that you've already had done recently.
And this kind of goes along with things that we've talked about before when you've been here, Vicki, with the surveys and that sort of thing that we've done, finding out how people are accessing care in the community.
It does. When we did the community health needs assessment, that was one of the issues that arose, is that people have difficulty accessing care, can't always get it at the time that they need it, can't get it in the locations, and so by moving towards this model, I think it will help with that as well.
Now, Crystal, your title is Care Coordinator. What exactly does that entail?
Well, at this point, because we are just starting out on all these new adventures, is really just getting everything organized, getting the workflow and processes in place, training staff, educating staff on these changes. And then it'll also be working with those care coordinators and to really become health coaches in the clinics for all those patients.
And we hear a lot of talk about health coaches, and can you kind of explain what that whole concept is? Well,
and we do currently have a health and wellness department they do work with a lot of companies in our area as well as our hospital employees. But the clinical health coaches will be a little bit different. They may be the ones calling the patients to check up on them. We see you haven't maybe got the blood test taken that we ordered for you, or, how are you doing with that new medication? And connecting them maybe with a specialist if they have questions or need follow-up, or maybe just connecting them with a community organization that'll help get them what they need, such as if we have somebody that we can connect with Meals on Wheels or, those sorts of things.
So what is your background in doing all of this?
Kind of learning a little bit as I go. I've lived in Logansport all my life, so I've worked in the offices, I've worked on the floor, so it's just kind of a passion of mine to kind of change the way that we're doing things so that we can have a healthier population in our community.
What do you think some of the barriers to people for maybe not following up on the things that they're recommended to do, say get a blood test? What are those barriers that exist?
Well, I think for everybody it could be a little different. Like I said, maybe they don't quite understand what the reasoning is behind it other than we're just ordering another test. Maybe for some people it's transportation. Maybe for some it's cost if they don't have insurance. So we're going to work with those patients to make sure whatever that barrier is, that we find out what we can do to help them.
Now, is this something that's driven by the hospital's goals? Is it something that's handed down from above? Is it coming out of Obamacare? Is it kind of a combination of all of those things that you guys are looking toward making these changes?
Because of the changes with the government, we've got the opportunity to become an accountable care organization. But really the hospital has chosen that this is going to be the best way that we can take care of our patients.
I think as from our conversations over really the last 3 years, this is the direction that we've been moving as the healthcare organization, the hospital for the community, is really focusing on the overall health of the community, health of our residents, and making sure that we have services in place to meet those needs here. And that we have a healthy community at the same time.
And as a rural hospital, I would imagine that you have some unique challenges that maybe you wouldn't see in a bigger city, or maybe you'd see in a different way in a bigger city.
And that's true, because we are so spread out. public transportation. We do have, access to that, but does everybody know that they have access to that? And those sorts of things. So, yeah, it is different rather than an urban setting living in the rural community.
So basically at this point, are you transitioning to become an accountable care organization, or are you firmly entrenched in being an accountable care organization at this point?
A little of both. We are part of the National Rural ACO, but we are just starting that process, as well as the medical home model. We have just started the process to become recognized as a patient-centered medical home. So it's just an early process. But hopefully within the next 30 to 60 days, as patients are going into the offices, they will really start to notice those changes.
Now, once you become recognized as the Rural Accountable Care Organization, then what happens?
Well, we are recognized currently as a member of the National Rural ACO, and over the next 3 years, we will continue to work with those patients to meet those quality measures, to continue to improve their access to the care and coordinate that care for the patient. So really, it's just going to be an ongoing process.
Okay. As far as, I guess, what this will mean for the hospital going forward, and it's basically just improving the services that you already offer.
It's changing the process, the care of, the care process in the offices is it. And, one of the things that we've also talked about is just that need for the preventative care. And so in some respects that, pushes that to the top, because as the physicians are, working with their patients and the nursing, they're, not only if they've got diabetes or other diseases, they're also looking, to make sure that people get their mammos, people get their colonoscopies, which is part of that as well. So that's, just kind of keeps moving that whole notion of being healthy forward in a way that it's going to start hopefully reaching, all of our patients.
What's been the response from the physician offices to this model? Because I would imagine it adds increased responsibility for them. Is it also going to add, are they going to have to add staff? How is that going to work?
We will be adding staff. In particular, we will be adding the care coordinators in the offices to help kind of navigate those patients. But also, the physicians, we've had a great response from them. They know that this is needed to better take care of their patients, and they're willing to do what they need to do to help us.
Now, is Logansport Memorial Hospital unique in pursuing this?
No. In this area, we are the only ones currently working on these projects, but as across the nation, this is the new way to deliver health care.
So what do you see going forward 10 years from now? What do you hope for the hospital to become? Or 5 years from now? I know it's hard to predict in healthcare 10 years out, but as far out as you can go as a result of doing this, what would you like to see as community outcomes?
As community outcomes, just better overall health for our community in general, not just for a particular group of patients with a certain diagnosis, but for everyone. And really the patients know they have that working relationship with the staff in the office, with their provider, and know that if they have a question, if they have a concern, they can contact us and we'll work with them to get through that.
Okay. And something that just popped into my head as we were talking, Vicki, and I thought about this the other day as we were dealing with weather closures and things like that. The Logansport Memorial Hospital Physician Network offices are basically just the doctor's offices affiliated with the hospital, correct?
They are. That's kind of the overarching name for what we call our physician group, Logansport Memorial Hospital Physician Network, Logansport Memorial Physician Network. It's a mouthful, and then underneath that are each of the different specialties.
So if you see a doctor who's affiliated with the hospital, and you hear that the hours are changing or that they're closed due to the weather, that would be your doctor.
It would be.
Okay.
It would be.
And that was just one of those things that popped up as we announced it, and I thought, we should probably refresh people's memory that you guys had gone to that model. I mean, it's been quite a while.
It's been probably 4 years.
Yeah. So,
Well, and the nice thing about that is, all of our offices are going to be operating the same. So, from our primary doctors to our specialists. And we're all on the same electronic health record. So if you do have to go to one of our specialists, they're going to have the same information and history on the patients.
very cool. I mean, like that. That's phenomenal, really. The amount of work that you guys have done to implement all of those things.
And we're, really for a small community, we're really well ahead of the curve when it comes to the electronic medical record. Our IS department has really done a superb job there. I mean, things are really connected. I mean, we're in the stage 2 of meaningful use, which is where basically all of that came from, and to the point where we're starting to wind that down, and then the next thing is phase 3 or stage 3 for meaningful use. So we've done a great job there. We really have.
So to recap, we've talked about the accountable care organizations, and we've also talked about the medical home concept. And can you just one more time summarize what exactly that means?
Really, everything kind of together means that you're going to start seeing changes in the offices where we're going to really start working with the patients and their caregivers directly to coordinate their care, give them the access that they need, and help them to navigate through the medical mazes, if you will, and just hopefully improve the overall health of our community.
And I think every industry has its own terms that if you work in that industry, you see them every day. And then when you start to hear them on the news and that sort of thing, it's like, what does this really mean? So I appreciate you taking some time to explain those things to the public. What can patients do to assist with this process?
Just when they come to their appointments, just to make sure that they're prepared. Always bringing a list of any doctors they've seen outside of their primary doctor, bringing their medications with them in the original containers, and even making a list of the questions that they have for the doctor so that really when they're in there seeing the doctor, they're not forgetting and, they go home and they're, I should have asked that question. If they write them down, it's much easier to go through those with the physician.
And we've talked a lot about the community health needs assessment, but is having a primary care physician something that people need to start thinking about? I mean, is there, I'm not sure how to word this, but a shortage of people in the community who actually have a primary care physician? Are there people? There are, but
there's a fairly significant number. And off the top of my head, I don't remember what the percentage was, but there's a significant percent of Cass County residents who, when we did the community health needs assessment, indicated that they did not have a primary care provider, and it is important, and it goes back to, just getting those routine annual exams so that you can stay on top of any issues that you may have, or identify, anything that you're not aware and catch it early. It's really critical. One of the things that you asked Crystal was, what do you hope the outcomes will be in 5 years or so? Another thing I think that we're hoping for is that people start to take, a higher sense of responsibility for their own personal health, which really goes to the whole health and wellness. The community, our community, really is starting to get on board with this. We've got, our Better Health of Cass County Coalition that's been meeting for 3 years or so, and there is a sense of community about wanting our community to be healthier, and I think that's also going to bode well for the implementation of the medical home model, because it is supported by a lot of other health-related organizations, as well as, I think with all of the work we've done with our health and wellness services in the community, that the employers are starting to really support the direction that the hospital is going with the overall general health and wellness of the community.
And Crystal, you kind of touched on like people not following up with tests, and it kind of is reminiscent of like with a teacher who assigns a homework assignment and says, "I'm not giving this to you, so I have something to grade tonight." I mean, your physicians are not prescribing tests just so that you can go have a test. It's for you.
That's correct. And, and that's also why we want to make sure we are coordinating that care with anybody they see outside, because we don't want to duplicate those tests either. But they are very, very necessary. So we have that overall picture of what's going on, and so that we can monitor those chronic health conditions as well.
All right, ladies, thank you so much. Vicki, do you have upcoming things at the hospital that you want to touch on today?
No,
I know
not
there's
yet.
a fundraiser today with the candy sale.
We're
Is
having a
that still
candy
happening?
sale. The volunteers are also, they have a raffle that they're doing for tickets to Beef and Boards. That drawing is next Friday. We've got our golf tournament coming up June 18th. That's the thing that we're really going to start working on. I keep putting off those phone calls to my sponsors because I can't imagine they're ready to think about golf, but
not with this weather out there. Maybe they are, though.
Yeah,
maybe they're so tired of snow that they're just
That's
anything
right.
to think about warm weather.
So that's probably the next big thing is the golf tournament.
All right, and of course you guys have lots of information available on your website.
We do.
Which is?
www.logansportmemorial.org.
All right, and thank you so much for being here today. Hopefully we'll see you the first Wednesday of March.
All right, thanks.
All right, that'll do it for this half of Talk of the Town. We'll be back with more.